Hello, everybody. There is a new podcast in our NPR International School. Today, in English is speaking for all our followers who speak English. This is a very important podcast, I think, because we're talking some special topic that is why the craniofacial system is the missing link in postural rehabilitation. Very, very important question. And did you know why I am telling that? Obviously, if you follow our school, you know why I am telling that. But it is important to understand why this system, craniofacial system, what means craniofacial system? Is the system which included the stomatognatic system and the cranium connected with the rest of the body. And that is the thing we always we forgot that situation, even in rehabilitation. Dentists we know always think only teeth, but the rehabilitation people, they also forgot the connection between the both system. One of them is the craniofacial system, the other one is the tonic postural system. If you follow our channel, you will know what is the postural tonic system. Is the cybernetic system that release in our body the muscle tone. And craniofacial system is, as we know perfectly, it is a very disturber of that particular system. And that's why today in the podcast, in our school, I want to talk about that situation. And that's important. You understand what I am meaning, right? And when we're talking about rehabilitation, we forgot as a physiotherapist, osteopath, we forgot, also in medical doctors, we forgot that craniofacial system is a big disturber. Break your mind a minute and think about that. Craniofacial system, we know very well that is a big disturber. Big disturber. And remember also that we cannot talk only in TMJs, about TMJs. TMJs is part of our system, of our craniofacial system. And the focus today is this very important topic that when the craniofacial system is dysfunctional, it will affect the whole body. The whole body. When we say craniofacial system, we're referring to the entire complex, the skull, the jaw, the temporomandibular joint, the tongue, the muscles, the fascia. All that is connected. There is a system called hyoid system that connect that particular craniofacial system with the rest of the body. Don't forget that. That's very, very important. It is a neuromuscular system and is a postural system because it's connected with the rest of the body. The trigeminus nerve, which innervate much of this region, is one of the most powerful inputs into the central nervous system. And trigeminus is connected with craniofacial system. This system influences how we breathe, how we bite, and how we balance in the rest of the body. It is the starting point in the postural alignment. And when it's dysfunctional, we have a postural disease. Don't forget it. And the craniofacial system include the TMJs. Many of the problems we see in posture are originated when the craniofacial system is not aligned. When the jaw is not centrated, we call that central relationship of the jaw. When the TMJs are centrated, they are in a good position. It is not problem in the TMJs, and in that moment we have a good function. But when the TMJs is losing the central position and the teeth are blocked, that position, that dysfunctional position, that is coming the problem. Why? Because this situation can be a lateral deviation, a retroposition, something who change the position of the jaw is creating the problem into the TMJs, because as for the physiology of the TMJs, that increased pressure into the TMJs is creating problems, and when it's creating problems, we know very well that the TMJs can deform, and the central nervous system have different receivers into that particular joint to defend. This sensors is sending the information to the brain, and the brain is creating a very bad defense, very, very bad defense, that is bruxisms. Bruxisms is a normal process to defend the TMJs. How? Destroying the teeth. Why? Because the central nervous system is thinking that this position of the jaw is creating trouble into the TMJs, and in that moment, in that particular moment, it's starting the block systems to defend. But what is happened that is creating more problem, because it's rotting the teeth, is increasing more pressure in the TMJs, is creating a lot of hyperactivity into the muscle, into the cranial muscles, the neck, etc. It's blocked the craniofacial sutures, and slowly, slowly is creating postural problems. The first alarm is pain in the TMJs, then hyperactivity in the TMJs. The most important muscle affected is the external pterygoideus. That's why physiotherapists try to release that muscle, but you're releasing, but you do not annulate the problem, who is the occlusion, and is creating again bruxisms, again more tension into that muscle. We have hyperactivity also in the neck, in the cervical muscles, and slowly, slowly, slowly trapezius, and slowly, slowly is going down and is creating a problem into the rest of the body. The rest of the body. That's important to understand. That is important to understand that it is necessary rehabilitation, because you release the muscles, you move the TMJs, etc. But if you do not annulate the occlusion, the problem is there, and the problem release. The problem is coming back. Relapses. Don't remember. Don't forget that. The common craniofacial dysfunctions, we call that malocclusion, but malocclusion is a very bad name. Is and because occlusion is occlusion, but this occlusion is making a block into the jaw position. The jaw position is the problem. The jaw position is the problem. Also, we have the tongue posture, but we have asymmetries, but the asymmetries is dysmorphisms. The jaw position is a dysfunction, and when we have a dysfunction in that particular joint, we start the bruxisms, and the effect is neck pain, headache, back pain, because when it's chronic, we have back pain also. When the craniofacial system is out of balance, obviously the body compensates. The head moves forward, lateral, the cervical spine adapts, the scapula rotates, the pelvis alignment shifts. These changes disrupt muscle change. Imagine that if the patient is an athlete, performance is going down. This is why when the athletes have a craniofacial dysfunction, reduce the recovery. The recovery. That means the performance. Fixing posture without addressing that key, that is annulating the teeth. It is only a symptomatic treatment. That's why in our MPR method, my functional postural rehabilitation, we have a particular um, method to do that. We annulate, we do rehabilitation, and then we put the jaw in the right position, and then we treat the teeth if it's necessary. Remember, jaw position is the key. That is the particular key. And obviously, we have an impact, impact into the posture and performance. The dysfunction is making alteration to the muscle change. When we have a dysfunction, we alter the head position and we change the balance. At the beginning, we have a compensation, at the beginning, when the body is not elderly, before 40 years old, we compensate. But when we lose the compensation, start the problem, very, very big problem. As I told you before, the treatment is in our school, deprogramming, rebalance the body, and then reprogramming. And that's very important. When you apply that system, when you apply that method, the patients are very well. And it's in that moment the collaboration between disciplines. That's very, very important to understand. Okay, we're going ahead in that presentation. And we know here that is very important. If you listened, the presentation is very important, the interdisciplinary approach. Deprogramming we use for that the body equilibrium device, the posturometer to measure, and the collaboration of dentists, orthopath, and physiotherapists mainly. And when you have a protocol and you speak the same program, the same language, when you speak the same language, at that moment you can work together. And NPR is the language, myofunctional postural rehabilitation. That's the language. As a conclusion, yeah, we can say that if you are working with posture rehabilitation and you ignore the craniofacial system, you are missing a critical piece of the puzzle. Remember that, a critical piece of the puzzle. A real rehabilitation starts to work together and to put in balance the craniofacial system and the tonic postural system. That's very important. When you understand that, this is the goal. This is the very, very goal. Don't forget it. That is the goal. Don't miss the point. Don't miss the point. And I have to say thank you to be here. But before I finish the presentation, that is a little presentation that we have for all of you in our channel. I have to say, if you like the channel, eh, subscribe to our channel. Our channel is free. My channel is the channel of Professor Di Rocca. I am the director of the NPR International School, and I am doing different videos. I have hosted also different professors of the school. We talk in different topics in different languages, and I invite you also to join our web application. If you go to the description of the video, you can join our web application also, the web application of our school, and there is our courses there, and also we have free material in also in that web application. And if you like the video, do a like, subscribe to our channel, and share this information. This is a free information for everybody, free information for all people, for patients and for doctors. And if you like our channel, subscribe. Click on the bell and you will receive all the information in my channel. And also, you can share the material with everybody. It's a free channel. And you can help to, to make a diffusion of our material for everybody, for patients and also for doctors. I hope you enjoyed the presentation. We see you in the next presentation in our NPR school in the channel of Professor Di Rocca. See you later. Bye bye, everybody.